My name is Olivnet, and it's always a pleasure to have your company. Now let's kick off today's edition. We'll begin by informing you that this afternoon at Urugwiro Village, President Paul Kagame met with a delegation of 25 global leaders from the Dialogue Group. The discussions focused on Rwanda's transformation over the last 3 decades, including the country's journey to reconciliation and unity, good governance, and innovative leadership. They also exchanged on opportunities for collaboration to support the next phase of growth through key priorities sectors. Led by Bobby Pittman, co-founder and managing director, partner at the Kupanda Capital and chairman of the Rwanda Development Board, Nick Alardis, president and CEO of Give Directory, and Jocelyn Wyatt, CEO of Allied. The group is visiting Rwanda for exchanges on leadership and development. Moving ahead, the plenary session of the Senate has adopted a report by its Committee on Political Affairs and Governance assessing the 2024-2025 activities of the Office of the Ombudsman, as well as its action plan for 2025-2026. We have details.
Following deliberations, Senators approved a resolution to be submitted to the government recommending the removal of obstacles that hinder the effectiveness of anti-corruption advisory councils and corruption committees in fulfilling their responsibilities. The report was presented after detailed analysis by the Senate Committee on Political Affairs and Governance. In different parts of the country, some citizens have reported instances where they were allegedly asked for bribes in order to access public services. One such case is that of Rekamuranje Betra from Kamonyi district, who says she was asked for unexplained payments by individuals attempting to auction her property in what she describes as an unlawful manner. Poor service delivery in decentralized institutions was among the key concerns highlighted in the review of the Ombudsman 2024-2025 activity report. The chairperson of the Senate Committee on Political Affairs and Governance, Honorable Gasana Alfred, outlined 3 major issues identified in the report, including corruption. He pointed to gaps, particularly within institutions that provide services directly to citizens. The analysis further revealed that anti-corruption advisory councils and committees established in both public and private institutions are not delivering the expected results. While senators commended the overall report, they also noted persistent gaps in addressing injustice and preventing corruption across various sectors. Based on concerns regarding the limited effectiveness of anti-corruption advisory councils and committees, senators resolved to submit recommendations to the government aimed at strengthening their performance. The President of the Senate, Dr. Francois Xavier Karinda, announced the adoption of the resolution. Among the key findings in the 2024-2025 report of the Office of the Ombudsman, 2,256 court cases were reviewed, of which 198 were identified as requiring retrial on grounds of injustice. In addition, under efforts to combat corruption through asset declaration compliancy, 10 individuals who failed to declare their assets were sanctioned in accordance with the law. Evans, RwandaTV News.
Now moving ahead, the report of the Parliamentary Committee on State Budget and Patrimony has revealed disparities in budget execution across districts. While some districts have utilized less than 10% of their allocated budgets, others have exceeded 60%. The delays have been largely attributed to the style development projects, which in turn slowed overall budget implementation. Evans has the details.
While presenting findings from field visits conducted in various districts and the city of Kigali, the chairperson of the committee, Honorable Wamariya Odette, highlighted several projects across the country that have stalled, consequently affecting budget absorption rates. Members of Parliament questioned the underlying causes of the project delays and sought clarification on measures being taken to address the challenges. Honorable Wamariya Odette emphasized that improved coordination, timely information sharing among relevant institutions, and stronger inter-agency collaboration would significantly enhance the implementation of delayed projects. Budget performance has also influenced subsequent allocations to districts. Gakenye district received 100% of the funds it requested for the following fiscal year, while Nyamasheke received 98% and Kayonza was allocated 93%. In contrast, only 2 districts received less than 70% of their requested budgets, with Gisagara receiving 64% and Musanze 69%. The remaining districts were allocated between 70 and 90% of their requested funds. Regarding development budget execution, Nyagatare district leads among those that have utilized over 50% of their allocated funds, standing at 61.1%. Districts with development budget execution rates below 30 include Musanze district at 25.1%, Nyanza district at 25.0%, Ngoma at 21.0%, Nyamasheke at 19.2%, Gisagara and Nyaruguru at 15.0% and 14.9% respectively. The committee underscored the need for stronger project management, improved procurement processes, and enhanced accountability mechanisms to ensure timely and effective utilization of public funds. William Evans, RwandaTV News.
Thank you, William. Now moving ahead to the Rwandan health sector, managers of health centers say that the introduction of advance payments under the capitation model will significantly improve the quality and efficiency of services delivered to patients, particularly those covered by Rwanda's community-based health insurance, commonly known as Mutuelle de Santé. We have details. In recent years, tensions have occasionally emerged between health facilities and the Rwanda Social Security Board. Health centers reported delays in reimbursement for services provided to community-based health insurance beneficiaries, arguing that the lag in payments negatively affected service delivery and day-to-day operations. Normally, we would treat patients first and then seek reimbursement afterward. However, the payments would often be delayed, and I would say the consequences were significant, including delays in procuring medicines on time, among other challenges. Under the previous fee-for-service system, health facilities would treat patients, document all services rendered, and then submit claims to the Rwanda Social Security Board for verification and reimbursement based on actual expenditures incurred. This system is now being reformed. The Rwanda Social Security Board has begun implementing the capitation payment model in the Eastern Province, starting with 118 health centers. Under this approach, facilities receive funds in advance to cover services for enrolled populations. Health facilities leaders described the reform as a timely and practical solution to long-standing financial challenges. We believe this will help us provide better services, especially in procuring medicines and ensuring that we have enough supplies for use. We also believe that the overall performance of health centers will improve. Capitation payments are disbursed monthly and are calculated based on several factors, including the size of the population served, service utilization rates, the range of services provided, and other performance-related considerations. The Minister of Health, Dr. Sabin Sanzimana, emphasized that the ministry will maintain strict oversight of fund management to ensure that the new financing model strengthens accountability, enhances efficiency, and ultimately improves the quality of healthcare services.
Health centers will now be provided with funds in advance to be used over the upcoming 3 months. They will be required to show how they have used the money. This is different from before, when health centers had to use their own funds and then were refunded later, which sometimes caused delays. We call this system capitation, and we will closely follow up to ensure that the funds are properly managed. Any mismanagement or misuse of funds could lead to shortages of medicines in health centers. With this new system, medicines will be procured in a timely manner. For those who use Mutuelle de Santé, this issue has now been resolved. Let us all work together to strengthen and empower Mutuelle de Santé, because by doing so, we are also improving our own well-being.
natwe badufashe dufatanye twese mituweli dukomeze tuyihe ubushobozi kuko nitwe tuba twigirira neza.
According to the Ministry of Health, the community-based health insurance scheme introduced 25 years ago has been instrumental in advancing healthcare access in Rwanda. Life expectancy has risen from 49 years in 2000 to nearly 70 years today. Currently, over 90% of the population has access to healthcare services, most of which are available within close proximity to their communities. Still on the Rwandan health sector, patients requiring specialized medical services are relieved that these services have now been included under the community-based health insurance Mutuelle de Santé, easing the heavy financial burden they previously faced, especially those requiring dialysis due to kidney disease. William Evans has the details.
In 2023, a 67-year-old man began receiving dialysis treatment. At the time, he had to pay at least 450,000 Rwandan francs per week to receive therapy 3 times weekly. His family described the illness as a heavy burden, largely due to the high cost of treatment. Since July 2025, the government of Rwanda has expanded the range of services covered by the community health-based insurance scheme, Mutuelle de Santé, adding 14 new services. These include treatment for major illnesses such as cancer, heart surgery, kidney transplants, and dialysis. Patients and their families welcomed this initiative, expressing gratitude for the government's commitment to prioritizing citizens' health. The impact extended to healthcare providers as well. Doctors who previously struggled to treat patients worried about affording their next dialysis session now find it easier to provide care. The Minister of Health, Dr. Sabensenzimana, emphasizes that services covered by Mutuelle de Santé will continue to expand as resources allow, ensuring that essential health care is both accessible and affordable for all citizens. Previously, dialysis treatment was covered by Mutuelle de Santé for only the 5-6 weeks, after which patients had to pay the full cost. Since the 2025 expansion, the number of patients accessing these services has increased significantly. Dialysis now costs less than 11,000 Rwandan francs per session for patients with Mutuelle de Santé, compared with 150,000 francs per session previously.
Now, moving ahead, the Bank of Kigali has introduced a new financing initiative aimed at empowering Rwanda's creative industry. Under the newly launched Be Creative program, Rwandan artists will be eligible for loans up to 1 billion Rwandan francs. Beneficiaries will repay the loans over a period of up to 5 years with a 3-month grace period before repayment begins. We have details.
Rwandan artists have long cited limited access to finance as a major obstacle to producing and promoting their work. Many say insufficient capital has slowed the growth of the creative sector. They now express optimism that the new facility from the Bank of Kigali will help unlock opportunities and expand their production capacity. I have liked the initiative. This is like a one-time occurrence in a lifetime, and I am so overwhelmed. We are very talented and have a lot of projects, but money has always been a challenge. Some of us self-invest in our craft, and all we needed was a financial push as an industry. We are ready to grow our projects as the creative industry. Our market is borderless. The Chief Executive Officer of the Bank of Kigali, Dr. Diane Karusisi, says the initiative was designed to strengthen collaboration between the bank and the creatives, enabling artists to access financial support that complements their existing capabilities.
We recognized that there was a gap. Artists are rarely trusted by any banks to access loans for their works, so we have worked with the creatives and the ministry to cover up the gap by availing a product tailored to their own needs.
The State Minister in the Ministry of Youth and Arts, Sandrine Mutoni, has encouraged artists to take advantage of the facility. However, she emphasizes the importance of proper planning, urging applicants to clearly define how they intend to invest the funds in order to ensure timely repayment.
The creatives have a wide market but lack the fund to support them produce more professional products. This partnership with the bank and the ministry will quicken this growth, and together with the BK Foundation, they will facilitate their capacity building because money alone is not enough.
Under the BK Creative program, loans will be repaid over a period of up to 3 years. The Minister of Youth and Arts will assess and review projects proposals before forwarding approved applications to the Bank of Kigali for financing. Successful applicants will begin repayment after a 3-month grace period.
Now to sport-related matters, Mathis de Klerk won stage 4 of the Tour du Rwanda, which was raced from Karongi to Rubavu, completing it in 3 hours, 5 minutes and 55 seconds. He became the 5th Belgian to win a stage in this race, and Gladys has the details.
Stage 4 of the Tour du Rwanda 2026 covered a distance of 127.2 kilometers. The riders first completed a 1.9 kilometer neutral section from the center of Karongi town before reaching Wupfune, where official timekeeping began. They passed through Ruwengira, Rutsiro, Gisiza, Kivumu, Pfunda and Rugerero. Dutch rider Jurgen Zommermann of development team Picnic Post NL started the stage wearing the yellow jersey awarded to the overall race leader. He had a cumulative time of 10 hours, 55 minutes and 6 seconds. The closest Rwandan rider was Samuel Niyonkuru of Team Amani, who was 44 seconds behind in the general classification. With 54 kilometers remaining, a group of 16 riders was leading the race before entering Rubavu town, where they were set to finish and complete laps passing areas such as Brasserie and climbing Pfunda. Before reaching the Rubavu market, 3 riders broke away from the lead group. Krejci, Kulitz and de Klerk attacked from the group of 16 and rode ahead together with 20 kilometers to go. They had built a 20-second gap over the chasers. Kulitz later dropped back, leaving Krejci and de Klerk to continue alone as they climbed the hill toward Pfunda. The 2 leaders left Kulitz 15 seconds behind, while the chasing group trailed them by 30 seconds. Kulitz later dropped back, leaving Krejci and de Klerk to continue alone. German rider Moritz Krejci of NSN development team and Belgian rider Mathis de Klerk of Sodal Quickstep Devo team entered the final 3 kilometers, preparing for the finish line, where de Klerk went on to win stage 4 of the Tour du Rwanda 2026. He described the stage as particularly challenging compared to the others.
It was a really hard race. I was really happy I could be in the break from start. It was quite close with Picnic trying to close the gap, but in the end we could make a nice gap. I kept saving energy as much as possible, taking a few turns but not too much. And in the end I could ride away with the NSN guy and first the guy of Lotto, so I'm really happy I could finish it off. I don't think I'm really high in the GC now because I was a bit sick 2 days ago, and yesterday I didn't have quite a leg, so I took it quite easy in the gruppetto and I lost 20 minutes. So it was good for today that I was at 20 minutes so I could go and break. So it's as you said, it's a long stage race, it's 8 days. So you have to try to save as much energy as possible and to try to win the stage. But in the end, it all comes down to being freshest in the end, so I'm really happy. Tomorrow's race, as a Belgian rider in the youth categories, you only do crit racing like this. So I hope I can get some of that experience from previous years to get a nice result here too with the team, because we still have 2 guys that can really make a big difference in races like that. So tomorrow I will try to help my teammates to get the win, get a back-to-back win for the team.
This Thursday, riders in the Tour du Rwanda 2026 will race around Rubavu district over a distance of 82 kilometers.
Now this marks the end of this bulletin. Thank you so much, dear viewers, for staying with us. We wish you a restful night.